Able IV cannula, 10-step standard operation method, positive pressure type. Step 1. Assessment. Assess the treatment plan and condition of patient. Puncture site and infusion tools. Select Able IV cannula as the best and safest puncture tool. With many national invention patents, Able IV cannula does not contain DEHP and prevent the tube blocking. It is safe and convenient for nurses and patients. Step 2. Preparation. There are mainly 3 aspects. 1. Routine preparation. Wash your hands and wear a mask. 2. Preparation of articles in treatment tray. Disinfectant, tourniquet, therapeutic towel, cotton swab, and others. 3. Preparation of IV cannula and wound dressing. We usually prepare 2 or 3 types of Able IV cannula for selection. Step 3. Selection. Tie the tourniquet. After selecting the blood vessel, loosen the tourniquet. Puncture is performed on thick and straight vessels with abundant blood flow and good elasticity, avoiding joint and venous valve. Generally, the selected veins include basilic vein, cephalic vein, median elbow vein, and superficial dorsal hand vein of upper limbs. Step 4. Disinfection. Wipe the puncture site as the center. Disinfect at least twice or follow the instructions of disinfectant. The disinfection area is 8 cm by 8 cm, larger than the dressing area. During it dries, take out the Able IV cannula and connect with the infusion set. Tighten the white cap. Exhaust air. Meanwhile, prepare the dressing. The positive pressure device of Able IV cannula is a needle-free connector with screwed mouth, which only needs to be rotated with the infusion device. On the one hand, avoid the pollution of rubber particles caused by repeated punctures of heparin cap by the steel needle to ensure the patient's transfusion safety. On the other hand, avoid end times of puncture injuries that may be caused by multiple connections and protect medical workers. Step 5. Puncture. Tie the tourniquet. Remove the white cap. Loosen the needle about 180 degrees in the right and left way and reset the needle to keep the bevel of the needle upward. Do not loosen the needle up and down to avoid the steel needle piercing the catheter. Exhaust. Tighten the skin with the left hand. Hold the needle with the right hand. Directly pierce the blood vessel at an angle of 15 to 40 above the blood vessel and slowly enter the needle. Pay attention to the blood return. After seeing the blood return, reducing the angle to 5 degrees, continuing to enter the needle 0.2 cm and ensure that the catheter is in the blood vessel. Able IV cannula. The needle point adopts unique 5-bevel cutting design with little damage and less pain. There is a large blood return cavity. The blood return can be seen immediately, thus significantly improving the success rate of puncture. The reason for the puncture at 15 to 40 degrees is that the appropriate angle can reduce the patient's pain. If the angle of the needle is too small, the resistance of the needle is increased, which is easy to cause the catheter to shrink or to scratch the outer membrane of blood vessels, resulting in the failure of puncture. Step 6. Insertion. Fix Y-type joint with the thumb of the left hand and retract the needle about 0.5 cm with the right hand. 0.5 cm is from the upper edge of white needle hub to the lower edge of transparent 3-way stopcock. Tighten the skin with the hand and deliver the catheter into the vein with the left hand. 3 do's. Release the tourniquet with the right hand and ask patient to loosen the fist. Turn on the regulator. 3 checks. Observe the puncture site, patient without discomfort, normal infusion speed. Retract the needle with the right hand and discard the needle in the dustbin. Step 7. Fixation. Remove sterile wound dressing with puncture site as the center and fix the dressing. The white device of the cannula is completely covered. Fix the strip tape with recording operation date, time, and the name of the operator in the mouth of the white device. Extension tube is U-shape fixed. Positive pressure connector parallels the blood vessel slightly higher than the catheter tip. White cap is fixed outward. Fix the infusion set with strip tape above the positive pressure device. Step 8. Flushing tube. After infusion, flush and seal the tube. The impulse method of pushing and stopping should be adopted to flush the tube. Step 9. Sealing tube. The whole material of ABLE IV cannula does not contain DEHP, safe and non-toxic. Ensure the safety of medical staff and patients. There is automatic and double positive pressure effect while using ABLE IV cannula to seal the tube. You only need to spin at a constant speed with a single hand, buttoning which takes only 3 seconds. ABLE IV cannula can reduce your workload and improve your efficiency. Step 10. Nursing. Nursing can be divided into nursing during indwelling period and nursing after needle pulling. The nursing during the indwelling period is to check the skin and blood vessels at the puncture site regularly in the process of infusion, and the blood vessel and puncture time at the indwelling site should be checked again before infusion, and the positive pressure device should be disinfected and the blood is drawn back to determine whether it is unobstructed before infusion. Nursing after needle pulling. During needle pulling, press the puncture site with dry cotton ball to make sure there is no bleeding, and then cover with sterile dressing to prevent phlebitis after needle pulling. Dear teachers, the above is the 10-step standard operation method of ABLE IV cannula shared with you. The first step, assessment. The second step, preparation. The third step, selection. The fourth step, disinfection. The fifth step, puncture. The sixth step, insertion. The seventh step, fixation. The eighth step, flushing tube. The ninth step, sealing tube. And the 10th step, nursing. Operation tips. Do not loosen the needle up and down and avoid puncturing the catheter in case it falls off in the blood vessel. 2. The positive pressure connector is a screw joint and the transparent silica gel at the joint cannot be punctured with a steel needle in case of leakage of liquid. ABLE IV cannula does not contain DEHP and can prevent the tube blocking. It is convenient and safe for nurses and patients.